What is a tuberous or tubular breast, and how do you know if you have one? I'm Dr. Catherine Hannan, board certified plastic surgeon in Washington, D.C., and I've made this model to illustrate some of the features of the tuberous breast. But the most important thing to remember is that it is not a deformity, it is a variant of normal development. What we think happens is during puberty, when your hormones are swelling and your breast tissue is starting to enlarge, that the skin of a more normal appearing breast is relatively soft and stretchy, and as the tissue grows, it can grow in all dimensions. So it grows a little bit round appearing. In a tuberous breast, the skin and maybe the connective tissue or fascia underneath the breast is really tight. So for the same tissue getting stimulated by hormones, it can only go forward and down. So the areola enlarges. Part of the reason that also happens is that the areola is thinner than the native skin around it. So the breast tissue finds it. So this tissue is still stimulatable. So if you're cold or stimulate it, the nipple gets erect, and many of our patients think that looks more normal. So they will actually often get a piercing there to maintain that appearance. Other features you'll note is that this breast is a little narrower than a more normal appearing or rounder breast. If you have two tubular breasts, they'll be really wide set apart and you won't get much cleavage. And there's definitely a deficiency of skin. This is normal skin here. You almost have no skin between the areola and the underwire line on a tuberous breast side. What does this mean for if you're considering breast augmentation or another aesthetic breast surgery? Well, we can't really just do a straightforward breast augmentation on this side for a couple of reasons. But one is there's not a lot of skin underneath the areola. So it would sit higher than the other side. In all breast augmentations, stretching out that skin envelope enlarges your areola. So something to know for every patient looking into that procedure, but it will definitely happen on this side and even more so. So your tissue will herniate through that areola even more so. So what we'd recommend instead is a lift or some scars around the areola to reduce the areolar skin, lift up the nipple higher up on the chest, and then we do some surgical dissection as well as potentially use an implant or some fat grafting to open up the lower pole and balance it compared to the other side, especially if it's asymmetric. If you have any questions, drop them in the chat below. Thanks for watching.